Some people seem to age better, or at least show that age, later than others. Today in part 3 of her series, New and Improved, Barbara tells us who and why some people seem less prone to lines and wrinkles. Barbara?
Well, Joe, doctors say it has a lot to do with skin color and a natural protection from the sun. That's one reason fewer African Americans and other people of color have turned to plastic surgery in the past. But those numbers are changing as statistics show Hispanics, Asians, and blacks now make up 20% of plastic surgery patients, those patients seeking to be new and improved.
I've been working out religiously for, it's been about 3 years. But in the abdominal area, it just hasn't, affected that area very much. Other areas I can see toning up.
Monica, at 40, has a problem many women and men complain about.
But I've just got this, like 2 tires around the middle that just aren't going anywhere. They're just hanging there. It's just gelatinous fat.
She started looking for answers.
I've gotten a lot of information from the internet, or as research library. I've gotten some books.
How you doing, Monica?
Hi, Dr. Dawson. How are you?
Her research led her to look for a plastic and reconstructive surgeon to learn about tummy tucks and liposuction.
What you're talking about is a full abdominoplasty. That's where we actually make incisions in the lower abdominal area, actually go down to the abdominal wall and place sutures in there that bring it together and flatten it out.
Have you had anything to eat or drink today?
No, not since 8 p.m. last night.
Monica is among a growing number of African Americans taking advantage of new plastic surgery techniques.
The majority of patients that I have who come in for cosmetic plastic surgery are white. However, we have noticed a significant increase in the number of blacks who are actually coming in for cosmetic plastic surgery. The types of procedures that African Americans will come to me about are procedures that generally have to do with the body shape and body image. A lot of patients come in for breast augmentation, breast reduction, liposuction, tummy tucks or abdominoplasties as we call them.
Doctors note that facial lines and wrinkles tend to appear later in people of color.
People do age differently. We've noticed over time that whites in general will tend to show their age more than blacks in general. When you look at Asians as well as Native Americans, they tend once again to show their aging less rapidly than Caucasians. We know that it has something to do with the skin. We know that the melanin in the skin tends to retard sun exposure. And we know sun exposure is a big variant as far as wrinkling or aging in the face.
Signs of aging in the body, like that spare tire around the middle that Monica complained of, can be changed with plastic surgery, as you can see from these after pictures.
Techniques are much better. I think we get a much better result. We can position it better and give you a much better outlook than, say, 10 or 20 years ago. So most patients who have the abdominoplasty done, the full abdominoplasty, they will normally be out of work for about 7 to 10 days, depending upon the type of job that they may have.
And the cost?
You're looking at a ballpark figure of around $5,500.
And then there's an additional cost for liposuction.
Basically $1,000 to $2,000 per area of body.
So how do you feel now?
I feel wonderful. This is something that you would never see me wearing before. An actual blouse tucked inside of pants with a belt on the outside. You would never see it before. I feel great. Just wonderful. I would do it all over again if I had to.
Incidentally, Monica last week had more liposuction around the midriff and hip area and says she feels that she looks even better than in the picture we just saw. There are 5,000 board-certified plastic surgeons across the U.S., but only about 50 of them are African American. Dr. Dawson, who we just spoke with, says that may be a reason many African Americans have not sought to have plastic surgery performed. He says he expects the numbers of both patients and doctors to continue to grow as the baby boomer population moves into the age to want to do that.
So we're talking between $5,000 and $10,000 really to get that done?
Well, depending on how much liposuction you add to it. He says about $1,000 per area for a liposuction. So,
okay.
But $5,500 he said for abdominoplasty, which is actually the tummy tuck.
Tummy tuck, okay.
All right.
Interesting.
It is interesting, and she certainly says she feels a lot better than she did before, and certainly looks very well. 6:22 is our time right now.